As of May of this year, 24 U.S. states and Washington, D.C. have legalized recreational cannabis. Other states and territories have legalized the substance in other forms, including medical use. As more people in the U.S. use higher potency products, more attention is being drawn to the potential health downsides of long-term marijuana use. An article published this week in the Free Press addresses this, and we should note Paramount is the parent company of both the Free Press and CBS News. The article highlights a syndrome known to be caused by regular cannabis use that causes intense symptoms. As the piece notes, the illness is responsible for several emergency room visits across the country. We're joined now by Josh Code, the author of that article and assistant editor for the Free Press. And we're also joined by CBS News medical contributor and editor-at-large for KFF Public Health News, Dr. Céline Gounder. Welcome to both of you. So, Josh, walk us through what some of these daily users told you about their experiences.
Thank you, Lindsay. So in my reporting for the Free Press, I talked to several young people. They were all daily cannabis users. And they told me about some pretty crazy symptoms: nonstop vomiting, terrible cramps, pain so bad they needed a morphine drip, dehydration, people's lips turning purple, just insane symptoms. And more than that, when you have CHS and you have vomiting and cramps for days on end, it's hard to live a normal life. There was one woman I talked to who lost a job because she couldn't show up to work because of her symptoms, and she was eventually almost homeless as a result. There was another young man that I talked to who said that he too lost out on job opportunities, and that if it weren't for the misery caused by his CHS symptoms, the nonstop vomiting, the cramps, the abdominal pain, that he wouldn't have quit smoking weed. And I just think that that's astonishing.
Are most people that you talked to, were they aware of the syndrome, or were they baffled as to what was causing this?
A lot of them had no idea what they were experiencing, and even some of their doctors hadn't heard of it before.
So, Dr. Gounder, what is going on in the body to cause these symptoms? What helps alleviate the symptoms, and what should the average person know about this?
Right, so this isn't new, but we are seeing an increase in this because, one, you have higher potency cannabis products, and two, with the legalization, you have many more people using and using more frequently. So cannabis interferes with, acts on the gut-brain axis. So at lower amounts of use, you can actually have nausea relief. But at much higher levels of use, so most days of the week for a year or more, that's when you really start to run the risk of cannabis hyperemesis syndrome. So cannabis, marijuana, hyperemesis, vomiting too much, and syndrome. So if you start to have these symptoms and you're a regular cannabis user, you really should be speaking to a doctor for help. The definitive treatment for this is to quit using, but there are some things that we use routinely to treat this, so IV fluids, electrolyte repletion. In terms of the emesis, the vomiting, the nausea, we treat that with antipsychotic medications, actually, like Haldol, and then benzodiazepines like Valium or Ativan or Klonopin. But ultimately, as I said, you really have to quit using in order for these symptoms to resolve completely.
And Josh had mentioned that a lot of people said their own doctors were sort of baffled by what was going on. Do you feel like the medical community is learning more and more about this, and they know how to spot it better?
I think it depends on what kind of medicine you practice. So I work in a hospital, I'm in the ER doctors, we're going to recognize this. But if you're somebody who's a primary care doctor in the community, you might only see one or two of these instances, not be familiar with it. And so I think there needs to be more education, both of healthcare providers, but also users, that they should be aware that this is a potential complication of long-term use.
Okay, Josh Code and Dr. Céline Gounder, thank you both.
Thank you so much.